Okay, so we are going to have a call to order. So we'll do a roll call in. Megan?
Megan Harvey here.
Maren?
Baron Golson here.
Lori?
Laurie Garcia here.
Ben?
Ben Hersey here.
Mary LaChapelle?
Mary LaChapelle here.
And Cindy Kwasinski here. So welcome to our January 11th school committee meeting. I want to welcome our two new members, Ben Hersey and Megan Harvey, to their first regular session. We're going to go right to the agenda, but let me just make an announcement that we will be going into executive session at the end of the regular session to discuss bargaining with the Easthampton Education Association, and we will be adjourning from executive session. So members of the community will have to sign off when we go into executive session. So the first item on our agenda is adjustments to the agenda. There's been a lot of discussion about where we should put different items, what we should add. So let's just open up that conversation. Anybody want to speak about it?
I brought this up briefly last meeting, just considering the possibility that perhaps there's a more effective way or a better way to organize what we do so that perhaps the community would have time to react to things we're doing, in the moment, or that maybe we could put our other in the front so that people could kind of hear where our head is at and what we're thinking about. So that was the thought that came up last time we met, but definitely open to discussion about it.
So I think one of the questions was whether or not public comment should go further down in the agenda. And the reason for public comment to go on the agenda is in the beginning is so that they have a chance to talk, tell us their feelings. So we have a chance to, at our next meeting, respond to or put that on the agenda. So usually what happens is everybody finds out what's going to be discussed on the agenda. They show up to discuss that piece. So I don't think it would be a good idea to move public comments someplace else because often parents and community members want to guide or at least weigh in ahead of time before we discuss what's ever on the agenda. And I wouldn't want to take that away from people. The idea of putting other closer up, we definitely were discussing, I know people thought that we should put it well before matters for action. And I think that's a really good idea because sometimes we're going through policy and just minutes and approving those. And that's really something that we don't really have to have the community sit there and boringly listen to us say our names again and again. So any comments about where we should put other? Any thoughts? I'm fine with just putting it right before school committee action items, right before payroll. Megan?
I'm not going to answer your question directly about the public comment part.
Okay.
One of the things that when this was brought up last meeting that I was sort of thinking about is if the public comment, if it's a non-controversial set of items on the agenda, sometimes the public speak portion is over in 30 seconds or so if no one raises their hand. Even if we don't move it later, could we say, the minimum time public speak will be open is 4 minutes or something, even if no one raises your hand, just to give people time to log on, not that I'm ever late to anything, but if there are other parents out there who sometimes are logging on, 601 or 602, and then they aren't able to get into the public speak. Is that something we could do rather than moving it later?
Well, if you notice, a lot of stuff already went where public speak follows. If you look right now, we have item 7, which is announcements, correspondence, and gifts. That usually comes at the beginning. So some of these things just got shifted around. So if we were to do as item 2, announcements, correspondence, and gifts, that would give people a little bit of time if there are items to log on. And then I would say just a brief announcement from the superintendent. Often the superintendent will say, the next open house or what's going on. I see Maren's got some ideas. Maren?
Well, and Megan, as the secretary now, this would be one of the roles that you would have. So maybe this has or hasn't been clarified, but what we have done in most recent periods, especially since we've been on Zoom, is that, and I do agree with the idea of putting correspondence sort of at the very beginning. And what would happen with correspondence, what Marissa was doing previously as the secretary, was that you would sort of do a very brief summary of all the email correspondence. And so that would be a way that email correspondence would be presented to everybody here as well as to the public. And then we move into public speak. So that is sort of a public speak way of presenting the information that is sent in as correspondence. It would give that buffer, as you're mentioning, to sort of immediately starting and shooting past public speak because no one's raised their hand yet. It would still only mean that if we had correspondence, but we generally have enough correspondence that that you could be able to do that sort of brief introduction and then move into public speak. I think that one makes the most sense.
Yep.
And moving, I definitely also agree with the idea of moving other before school committee action items, which is just the listing out of budgetary changes generally. So I think those two make a whole lot of sense. Other than that, I don't think we need to move things around, but that's my personal opinion.
I agree. And that is what we discussed with Megan. By the way, Megan is the secretary. So she does understand that she will be summarizing, paraphrasing all of our correspondence. That does give people some time to log on. We're not starting exactly at 6 in terms of public speak, but I agree. I think after correspondence and gifts, we just, item number 3 is public comment. Is there anybody else who has any other thought? So does someone want to make a motion to always have announcements for correspondence and gifts moved to item 2, public comment item 3, and wherever matters for action are going to be, other would be ahead of that, above
Cindy, I
that.
don't know if this needs a vote, though.
Well,
you're the one that sets the agenda. If
we
you
do
feel
set
confident
it.
with that, and
We do set it, but Sue thought we ought to just make a vote to kind of lock it in and, state that we agree with it. It's not like it's a big deal. It was just more of everybody putting our heads together and doing that. So does that sound okay?
well, my concern with locking it in is there has been times where there's been important shifts needed by you as the chair going into a meeting. Something needs to be
Yep. shifted
around.
That's
If you're
always,
locked in saying this is how it has to be, I mean, I'm fine with either way, but
that's always our option when it comes to emergencies, when we have to shift something or when we have a speaker that we have to move up. We have the ability to do that. It's just that there was some talk about, let's put this here, let's put this here. This way we just all agree on basically, unless something else changes and the need arises, we're going to hold it this way. Does that make sense? Okay. I mean,
I'll make a motion then. I'll make a motion that we shift the generalized agenda for our meetings that will start with announcements and correspondence, moving to public speak, then a series of items as generally we use, and then with other and school committee action items concluding the meeting as a guiding outline for our meeting agenda.
Love it.
I'll
Thanks,
second
Lisa.
that.
Okay, Megan,
Megan Harvey, yes.
Maren,
Maren Goldstein, yes.
Lori,
Laurie Garcia, yes.
Ben,
Ben Hersey, yes.
Mayor,
Mary LaChapelle, yes.
and Cindy Kuzensky, yes. So great. All right, so we are going to, let's see what time it is, 6:11, so that's good. We're going to open up public speak. I'm going to ask people to hold your comments to 3 minutes and state who you are. And please indicate now if anybody would like to make a comment. We'll be scanning through. Sean Sheehan has raised a hand. Go ahead, Sean.
Okay, hi.
I'm
Hi,
scanning
everybody.
through, sorry. Go ahead.
All right. So this is in reference to my January 4th letter that I sent to the school committee. I first want to welcome our 2 school committee members, and I also want to thank our school committee members for, staying with us during these tough times, and want to thank our 2 new school committee members for signing up and helping the teachers out, helping the students out of Easthampton. So I'm writing to request that the school committee begins bargaining with the Easthampton Education Association to hire permanent building substitutes to address staffing shortages due to COVID and other leaves. I can just say in my department, I'm going to have 2 science teachers out because they have different things going on. And the current plan by the superintendent to just tack on snow days when school must close due to staffing problems is not going to be feasible because we only have 6 more days left. We did have a snow day on Friday. I'm not upset with that. But we don't have really many days to play with. And we have a large number of people that are becoming sick now at the moment. So I just want to say that the offer that was provided to the Easthampton Education Association was going to require a licensed teacher to just be paid $5.75 more an hour, which is really unacceptable, providing the experience that is required of this individual. And also they got to pay off student loans too, if they're younger, and also got to pay off bills as well. And we also want an adequate number of sick days, especially if this person has to quarantine for COVID. So I look forward to hearing from you, and I'm glad I'm on the agenda during your executive session. And thank you again.
Anybody else? Megan, take a peek, make sure I'm not missing someone. If you want to speak, please indicate now. Okay, I see Scott. Go ahead, Scott. You're on mute, so you're going to have to unmute. There you go.
I think I'm unmuted now. Can you hear me?
Yep.
This is in regards to an email that came in. It was yesterday's email, update the families email that came in. And I guess I just have some comments and maybe even some questions. I don't know if they'll be answered tonight or not, but they're moving away from the test and stay, which is, I went through the DESE update that was updated on December 30th, and I was looking through all the information in there. It talked about COVIDs and when students can return to school after contact, et cetera, et cetera. And I nowhere in that document that I find anything talking about DESE wanting schools to move away from the test and stay. It also says that the quarantine will be the only option for the unvaccinated students. I'm not quite sure why that's going to be a situation. It seems as though there's a big push for the vaccine for the kids, even though the vaccine's still only under emergency use authorization. So it's not as though it's been fully FDA approved. And then also when we're talking about masks and moving into the N95 masks, and one of the things that comes to my mind is after working in construction for over 35 years and wearing an N95 mask for an awful big part of my life, I know that you cannot wear an N95 mask all day long without it becoming sacrificed. It gets wet inside. It gets hard to breathe through it. So I'm not exactly sure how that's going to be implemented in a fashion where these kids aren't going to be breathing in to a wet mask all day long. And I would imagine that that would become biohazardous material if we're talking about kids that are walking around potentially infected with COVID. So, and then is there going to be a receptacle for biohazardous material for these N95 masks where these kids can dispose of them? So, I mean, it kind of becomes, there's a whole lot, there's more questions, I think, than answers when we start to implement this, these new protocols here. And, I have a lot of other questions and issues that I've sent emails to Dr. Leclerc. And I was awaiting on I was hoping to get a response today from it. I had sent emails out before the winter vacation and resent another one this morning with a lot of these same questions that I'm asking right now. I'm not exactly sure why we're moving away from it seems like a lot of these questions that I've arisen to some of the principals and the superintendent, everybody wants to fall back on what the DESE recommendations are. And so I just want to make sure that if we're going to be moving away from test and stay, that's actually a DESE recommendation, because it seems like that seems to be the protocol that the Easthampton School Department wants to follow all the time. So I'm not sure if that's something that Easthampton has come up with, or if that's something that's a recommendation provided by the state and DESE. So those are my questions. Thank you for giving me the time.
Thank you. Anybody else? I'm looking through. If you want to speak, please make sure you indicate now. Megan, I don't see anybody. Do you?
I don't see any indication.
Okay. All right. So then I am going to close public speak. Thank you. All right. Let's go on to presentation and discussion items. Is that you, Dr. Leclerc?
Yes, thank you. So tonight for our presentation, we're going to be talking about COVID. I think it's really the star of what's going on right now. Not much else is happening except COVID right now, so we're going to focus on that a little bit. So hopefully I'll address some of the issues that Scott has brought up this evening. So just to summarize the case counts that we had last week, and I want to put some context around them. We had a total of 91 cases last week. Many of them were reported to us by families from rapid tests or at-home tests that they did over the vacation. And they were alerting us as school began last week that their children were positive. And many of the numbers were also related to pooled testing. Pooled testing was very condensed last week. We had 2 professional development days. So it was scheduled to be condensed into 3 days. That puts a lot of pressure on our team to move rapidly through our 5 buildings to get the testing done, but they were really striving to do that. And then, of course, we had a snow day on Friday, so pooled testing did not happen at Whitebrook on Friday. as it was scheduled to. It occurred on Monday of this week. So we're a little bit out of sequence this week with pooled testing. But we had 91 cases. And so letting people know that 91 cases is really the biggest number we have ever seen for COVID cases. And I looked back at the week before Christmas, which was a 4-day week. It was an abbreviated week. We had 14 cases in total that week. And so 91 coming back into school is a big number. And I just want people to understand that 91 cases requires a tremendous amount of work because for those students that are identified in school, there's contact tracing, there's identifying close contacts. Are the close contacts vaccinated, unvaccinated? Are they signed up to do test and stay, not test and stay? Do they need to quarantine? Getting messages out to the school community, retesting pools. The other piece I should let you all know, if you didn't read about it in the news across the state, was that because so much testing was going on last week for COVID, the labs that take our samples and process them were overwhelmed last week. And so they pretty much notified us. We do a 2-sample draw in Easthampton. One is part of the pool, one is an individual sample. The laboratory only tests the first sample, the pooled sample, and then if the pool is positive, they would then proceed to test the individual samples. They were unable to test our pool samples our individual samples in a timely manner last week because of the surge. They had too many tests to do. They had staffing shortages, so they encouraged us to, if we had a positive pool, to test the students individually ourselves, which meant that our nursing staff had to test all positive pools. And we had over 20 positive pools last week. So it was incredible, the burden of work placed on all of our staff. And I commend our nurses with the highest commendation. They were amazing. We have a team that supports us from the laboratory company that we work with. And so they come in. We have 3 people that come in weekly to do the pool testing for us. They were amazing, very adaptable. Even though one of them got COVID, it was a tremendous workload, a heavy lift for everyone. And beyond that, the principals also have a huge workload doing the contact tracing for students with the nurse, because the nurse is dealing with all the other regular medications and regular medical issues that they already have to deal with in a busy day. And just to remind everyone, one nurse for about 400 students is a lot. They're busy on a boring day. And so to add all of this to their plate was really a lot last week. So COVID really took over everything we did last week. And it was the basis for some of the decisions that we made and some of the discussions that we began embarking on. So a few things that I would say. Last week, we made the decision to stop having spectators at athletic events. It wasn't something that I wanted to wait until this week to do. I didn't want to let a week more lapse. It is not a permanent decision. We're just simply taking a pause to try and let the numbers go down, and then we'll revisit it. So that was a decision that we made last week. And I know that not everyone is happy with that. I know many people are not happy about that, but I hope that we can get back to having spectators in our stands very soon. So we'll keep an eye on that. As Sean said, we do have staffing challenges, and I will say, knock on wood, we have been very fortunate compared to other communities. I will say it, as I've said it many times to this group, we have a highly vaccinated staff, which I think is really helping us. And so our staff, we've had a few people out, but it has been similar to weeks in November and December. We have not seen a surge or a large uptick in COVID cases amongst our staff. And I hope we don't. So we're keeping an eye on that. And we're following guidance from the Department of Ed, which is ever changing. They sent out new guidance at the end of December, and it aligns with some of the other national guidance around adjusting the days of isolation and quarantine for positive students or close contacts. So we have made some of those adjustments to our protocols. And we are also looking at a few other pieces of information. We're awaiting DESE guidance on contact tracing. Contact tracing is overwhelming our staff, and particularly at the elementary level. It is a little bit more manageable at the high school, where we have approximately 80% of our students vaccinated, because if you're vaccinated, then you're not a close contact. So it is a little bit more manageable there. But at the lower grades, where we're running about 50% vaccination rate, it is a lot more cumbersome for the staff to do contact tracing. So we're hoping that DESE releases new guidance. We're told this week on contact tracing, because we would like to move away from that a little bit. And again, the advantage is if people are vaccinated, it will not really matter to them. It's really the unvaccinated. So we're hoping that people will consider that as they are thinking about vaccinations and whether they want to do that or not. And I will say that we're in constant contact with the city health nurse. We share all of our case information with her, and the city health department is just overwhelmed with COVID cases as well, and contact tracing. I see Megan nodding her head, but to the point where we've had to restructure the way we have been sending the information to the nurse, because we're just sending such high volume that she can't keep up with our information. So the other thing that I would say is we had a few things that came up in our COVID response meeting today. One is around positive pools. And we have had a few rare instances where a positive pool is identified, and we test the students in that pool, and all of them turn up negative. And it's perplexed us why we have a positive pool, but everyone's negative. And so our practice has been that we send that group of students home and say, either go find a PCR test and get that done before you can return, or you need to stay out for 5 days or 10 days, whatever time period this was when this occurred. And we know that getting a PCR test right now is nearly impossible. So we've had some discussions today at the COVID response meeting, and we're going to adjust our protocols for this situation if it arises again. So if we have a positive pool and all of the participants test negative, we will allow them to stay in school, and we will provide them with another test the next day. And at that point, if they continue to be negative, we will allow them to stay in school. So that's an adjustment that we'll make. And and we may have more to say about that. Megan may want to report out and add some information when she gets to the COVID section on the agenda and talks about the COVID advisory team. The other thing that we've been exploring that I alluded to in the letter that went home to families yesterday is we're beginning to have discussions about what the end of test and stay will look like. Now, we're not saying this is going to happen tomorrow, but we are considering what we can do to move away from that. And so at the COVID response team meeting today, test and stay, a discussion around moving away from it was met positively by members of that committee, including Megan Harvey. And I'm sure she can speak for herself after at the that section of the agenda. So just to reiterate, test and stay is an enormous burden on our nurses. And it was very necessary at the beginning of the school year when children ages 5 to 11 did not have the option of a vaccine. So without a vaccine, this really was the only tool we had to keep children in school. And that was our goal, to keep children in school through test and stay. Cases were very low. It was manageable. Now, since the end of November, when vaccines became available for ages 5 to 11, and they've been available at the upper grades already, people have had the opportunity to get a vaccine for their child if they choose to. And we think that it is time for us to kind of take that mitigation strategy or that tool away and hope that parents get the vaccine for their child. And so that will, by getting the vaccine, not only are they helping their child, but they're helping our staff so that we're not burdened by having to test children every day. Because this does take a tremendous amount of time, particularly in the morning, when if we're testing a group of students, it may take the nurse the first hour of the day, but she also may be handing out medications. She also may be doing diabetic blood sugars, and a host of other things. So it's really something that we are considering. Other communities around us have already stopped test and stay or are in the process of stopping test and stay. And what they have noticed is that it has increased the number of vaccinated children that they have. When people realize that the only option for their unvaccinated child will be quarantine, some families will choose to get a vaccine. So it may not be for everyone, and that's okay. But we cannot, the program won't continue after this year. But I think it is, I'm really feeling as though I want to do whatever I can to make the lives of our nurses a little bit easier, because they are really unsung heroes in this exercise this past year and a half. So if there's a tool that we can take off their plate and eliminate some of their workload, I think we should explore it. So at the COVID response team, we discussed giving parents notice that we were going to be moving in this direction with a target date of March 1st to allow families adequate time to seek out vaccine appointments if they so choose. On my end, on the school end, we're going to try and arrange another vaccine clinic for families, because we know that vaccines are not easily available in the community. They're available, but maybe not as easily as they were a few months ago. So we're going to do our part on, organizing another vaccine clinic. And we hope to see numbers increase, because what we have noted is that vaccine numbers have stagnated in the district since maybe the beginning of December, since that initial push of ages 5 and 11. For our high schoolers and our 7th and 8th graders, vaccine numbers have not really changed since the summer. And we haven't really gone up at all. So this will be what we hope will push people to make a decision about vaccines, whether they want to move in that direction or not. I also want to say, related to COVID, and I can take your questions whenever, the extension of the mask mandate I included in the message last night. The Commissioner of Education extended the mask mandate through February 28th. That's for all school districts. So we'll keep doing that. We're really encouraging people to move away from cloth masks, at least temporarily, while we're in this surge. There's enough evidence to demonstrate that surgical masks are better, KN94s, KN95s. So there are other options. I also want to say that during this time, we have ceased in-person gatherings as much as possible, meaning staff meetings have gone virtual. Some professional development has gone virtual. We're not encouraging families to come to the school for appointments. Again, if you can do a virtual meeting or a phone call, that would be helpful. If you do need to stop at the school, we'll ask you to take off a cloth mask and exchange it for a surgical mask. While you're in our building, we want to do everything we can to protect our staff and students as much as possible. So I think I'll stop right there. And I don't know if Megan wants to correct anything I said, because there was a lot of information. And we just talked about some of it at our COVID response team meeting today.
The only thing I was going to note is I think that I wrote down March 4th as the target.
Oh, March 4th. I'm sorry.
Okay. Which I think is the end of that week. But that, I think we counted
It
out
is.
7
It's
weeks.
the Friday. Yep.
And the logic there was that you have then a set period of time to start the series, and then you have time to complete the series, and then you have time for the 2 weeks after your final dose. And so by the time this program is phased out, you will have ample opportunity to have made it all the way through, plus the 2 weeks afterwards, if you are starting the series now or within the next 2 weeks. So yeah, I can do, should I go through and do sort of the COVID advisory update, or do you want me to do that later, Cindy?
So I would keep going with where we're with our agenda, because we're going to get to that. I do have a couple of questions. One, you said some communities have already started to end test and stay. Do you know which communities have done that?
Amherst did it at the beginning of January. They notified families in December. And I think Hadley is moving away from it right now. Those are the two, but I can get more names tomorrow. And some communities have not done it at all. We know Hampshire Regional has never started it. So there are communities that are already not doing it at all.
So Desi is okay with us stopping test and stay?
Yes, absolutely. We'll continue to do pool testing. I want to be clear.
Right.
We'll continue to do pool testing, and we will also continue to do symptomatic testing. If a child is not feeling well and they go to the nurse can test the student.
Lori, and then Mirren.
I just wanted to reiterate something Allison just said, that some districts, including the district where I work, never started it. They never started pool testing. Nobody has to report if they're vaccinated. And our poor nursing staff is so over inundated with cases of COVID. I now receive emails saying there are cases in your classroom, but we're too overwhelmed to even contact trace. So I want to let everyone know once again how safe we have done things in Easthampton, and we should all be very proud of that.
Mirren?
Yeah, so there's a lot there. So I guess in terms of what you just talked about, Dr. LeClaire, I guess the question for me is how do we want to proceed on some of these things? I want to also just agree in terms of what Lori just said, and certainly what Dr. LeClaire said. I mean, our nurses and our administration that have been dealing with all these things have been working extra hard and really appreciate all that hard work. But I just want to sort of also want to sort of understand how we want to sort of go into some of these things. So there's some big topics here, you know, sports spectating, contact tracing, test and stay, you know, some of the different things that are being stated by DESE. You know, this is called the presentation and discussion items, but are we looking for votes of approval on any of these items, or are we just wanting to discuss our opinions on them? I mean, what is the sort of goal on how to proceed with a number of these really large topics?
I think that if I recall, and please correct me if I'm wrong, but I think this group at the beginning of the school year said that they would rely on recommendations from the COVID advisory committee. And that committee did meet today. Megan is on that committee for the school committee. We have Sarah Mochek facilitates that committee. We had Bridget Diggins from the City Health Department. Bree, our City Health Director, is usually on that committee. She was not available today. But we had one of our school district nurses, Amanda Judd from the high school. We have a large group. Sean Sheehan is in that group, the EEA president. And that group was very receptive to some of the things that I've just talked with you about today, including the recommendation on test and stay. So if you are still following the beginning of the school year, the recommendation that you would follow the COVID advisory group, then that I think is important to know that they were in favor of doing that. They also were in favor of the adjustment to the negative. If we have a positive pool, we can keep the students in for 2 days and do 2 rounds of testing. If they all test negative, they were fine with that change in practice, and I'm happy to write that out for people. The spectator piece, I guess I would defer to you. I did not bring that up in COVID advisory. If it's something that you want to explore and discuss now and take a vote on, I think that's fine. The way that I feel as though I presented it was related to the data. And I feel that, you know, I said it was only going to be a 2.5 week pause, and then we would review the data and decide whether spectators would be welcome back in or not. And I think that, to me, that felt like it mimicked some of the decisions you've made in the past year around sports and keeping students safe. But I'm open to hearing any concerns you have about that decision. And what else are we talking about? The mask mandate, that's not a school committee decision at this time. That's, again, still in the hands of the Department of Education. When we get to the 80%, which of course we're already at the high school, we could apply for a waiver to remove masks, but I've not brought that to this committee yet, since the city of Easthampton still has a mask mandate. It hasn't really felt like we should move there yet. And the communities that did take off their masks have all put them back on because of the surge. So
Right. That
So,
would be,
yeah, I don't think we need to go there yet, but
no. That would be something I would really have a hard time with. So I had a couple of questions.
I just don't know if we're done with Marin yet, Cindy. I don't know.
No,
I kind of left him hanging there, so I don't know if he has a question.
I wanted to just weigh in on what Mirren said, though. Like when you were asking about different things that we have to vote on, and we certainly could vote on any of these, but as far as the spectators and sports, school districts that I'm aware of are moving so quickly, they have to make these decisions on their own. Like on a given week, they'll forfeit a whole game, or they'll postpone a game and try to reschedule it. they will ban all spectators. They'll ban just visiting spectators. And what I'm seeing is that every community, every school district, it's the principals and the whole team there with the superintendent and the athletic director putting their heads together to saying, okay, look at the numbers now. What do we have to do? And I think that the only way we could fairly start controlling that, if we were going to start weighing in, is that we'd have to have meetings all the time to make sure that we were looking at changing circumstances. For instance, I'm a teacher in Hatfield, and we've changed on a given week with 4 different games going on in a week. We've changed at least twice the circumstances of how that game is going to happen, because the numbers are just getting so crazy here. So that was my only piece I wanted Maren to know, in terms of, I don't think we should slow down the decision that I think will often change from week to week. That's my personal thought. So back to Maren and then Lori.
So yeah, my question was certainly not to try to slow down process. I'm just trying to understand our current conversation right now. I certainly agree that we need to be quick on our feet, and I support Dr. Leclerc's decision to step forward and try to make our students and our community as safe as possible. And if that means, unfortunately, shutting down spectation of our sporting events for a short term, reviewing that data and revisiting, I certainly encourage this committee to empower her to do that. I will say a couple things, however, in terms of bigger picture. I think there's been a couple different pieces that I am very concerned about around when we are looking at state level decisions and our school district following those guidelines. I think that, as certainly has been reported, there was some big issues around masks and testing kits that were being given to teachers that was not following through on promises that the state made. Obviously, we don't have a lot of power to tell the state that they need to do a better job, but I certainly think that they should be. And I want this committee to consider putting a letter forward to the state. I know other committees across the state are doing that. I think that the governor and the state is doing a very poor job in terms of preparing our population and our communities for testing. The fact that we went into the holiday season when we knew everybody was going to be gathering and not have already prepared and rolled out increased testing plans, regardless of any variants. That wasn't already on the books and implemented is extremely a poor rollout at the state level. And I think our community and even the mayor's work to bring on local testing and working with Northampton to do that was, stopgap measures that our local community could do. But again, very poor follow through at the state level. I will also follow up with that. I think that the guidance that we have around contact tracing, as much of a burden as it is incorrect. That with the number of cases that are currently showing up with this current variant that is having students or anybody in the population be able to get COVID, regardless of vaccination status. And we follow the state guidelines that if you're vaccinated, you're not eligible for contact tracing to know that somebody has COVID, I think is an incorrect decision. And not that I want to overburden anybody with more work, but I think that guidelines, that contact tracing doesn't include vaccinated people in the current data that's coming out about this variant is incorrect. And I would ask, like I did in September, that we question that and revisit that and possibly make a different choice in our local community, because people with vaccinations are still getting sick. And so to not include that in contact tracing and communication is incorrect, in my opinion. And again, that's a burden to the people that have to do that contact tracing. And I think that that would mean that we should have additional staff helping those nurses making the calls and doing that contact tracing, because what Lori's example was about being notified that somebody in your room has COVID, but we don't have time to tell you who or how to deal with it, is again a poor decision-making process at an administrative decision. So I think that personally, I think that we should look at improving our contact tracing and including improving the support of the people doing that work and finding out ways to do that. So I think that that's something that I think is really important. And the last thing that I'll say before I sort of get off my soapbox, I guess, is that I think that test and stay is an important measure to include. Again, I recognize the extra work that involves, but I don't think we should be doing away with it. And so I think that we should allow that for people. There's different reasons why we're not at 100% across every single population in our district, and we shouldn't. I don't think using that kind of a stick to force people to move in that direction by taking away the means for students to still be in our schools and not forced to quarantine at home, I don't think is the proper direction we should go in. I think we should continue to use test and stay through the end of the year. And I think that we should, again, look at what kind of resources we can get to support the people that are helping implement that kind of a protection for our community.
Lori, did you want to say something? I do have a comment about the pool testing issue that I want to weigh in on later, but go.
It had a lot to do with sports. I just want to say that I also think that people should realize that some districts, including Wellesley, at the end of December, decided to pull out of winter sports altogether. So I applaud Dr. Leclerc for making the decision to keep our community safer by not allowing spectators at this point. And Maren, what you said is something that I've been saying all along, that DESE, Commissioner Riley, and our governor, none of them have handled this well from the beginning. So this recent fiasco has just been another example, but I really don't feel that teachers should put our district at blame for not having the right mask right now, because, you know, you can, and I know that it's a financial burden, it's hard to find. It's really not even hard to find. You can get good, safe masks. And as educators, if we have to go out and buy our own masks right now because the district can't get a huge supply, I mean, it's something we have to do. And it's just to help keep ourselves safe. And as far as the test and stay goes, I mean, I know we're not voting on it now, but I also support Dr. Leclerc's decision. And I appreciate that the COVID response spoke about it today. And we have to realize, even with test and stay, and just hearing about the positive pools and then the negative tests, that I just sent something to Megan that came from research at Cornell that's going on right now about how faulty all of these tests are, including a PCR test. This is new research from Cornell that says they are only 70% valid right now. And I know people that have tested 3 times with the PCR, and it wasn't until the 3rd with this recent variant that it showed up. So test and stay isn't a safeguard as far as I'm concerned. People have to get vaccinated.
Ben?
Actually, Megan, your hand was up first. I just want to chime in, Maren. You laid out, I think, like really important points, and I'm with you on the problems with DESE 100%. And I'd be happy to kind of collaborate on a letter if anyone wants to do that. And I'm also interested in the idea of improving staffing. I think it's massively important, both around nursing, but also in the realm of substitute teaching and that kind of thing. But I think that's like that's been a thing we've been sort of looking for a long time, and there's just no one. Like that's what that impression I get, is that there's just virtually no one available. Plus, I don't know where the money comes from exactly, and I'd be curious to have a discussion about that too. How, like, this, maybe we'll talk about this with Sean Sheehan, but that's a big question. How do we pay for these things? But I'm also curious about masks and testing, and I'm wondering if, like, we can, to what degree as a district can we provide testing to families and or like high quality masks to families. I would personally love to be able to, you know, have some sort of organized thing where we give families and students the masks that they need. And I again, this is a money issue, but if we could get teachers the masks that they need too, I want to take that off their plate as well. I feel like sort of requiring teachers to go out and buy their own masks just feels like yet another thing that they're being asked to do. So it all feels like a money question to me, but I'm loving this conversation.
Megan, did you want to say something?
Yeah, I wondered if one of the things that might be helpful is if we took each of the sort of updates that Allison explained to us, like test and stay and the masking, and if I just sort of could walk you through the discussion of the science that we talked about that and sort of where it comes from, and tell you and sort of explain how the COVID advisory group came to those decisions, and then maybe answer like one at a time. Maybe we could answer questions on those, because it would be nice to have, I think, support from the school committee as these changes are being made, even if they're being made at sort of the leadership level. It's just so parents can understand and we are transparent about what the science, like, why would we say it's okay to stop, test, and stay? So that's is my suggestion, and I'm happy to sort of do that. But if you have a different question, Cindy.
I do. So my concern is not so much the test and stay, although I do have some questions about that, but the idea that if you get a positive pool and you test everybody and you can't find that person, instead of having them take a PCR test, a second PCR test, you would just do a rapid test on them for 2 days. And if you don't find them, you don't find them. That concerns me. And I don't mind letting everybody know I'm a teacher and I am vaccinated and boosted, and I got COVID, and I was being tested as a close contact every day with a rapid test. And each day I came out negative, and it was only a PCR test that came back positive. And what was explained to me is that unless, especially for vaccinated and boosted people, unless you reach a very high level, you can continue to test negative, even though you have it. And so I'm really curious how, if I'm uncomfortable with not following up with a PCR test if you have a positive pool and you can't find that person. So that was my biggest question, because I know that I had signed up for a PCR test, and that is how we found out. And I was able to keep it out of the classroom and out of school. So Megan,
Let's start with that one.
Yeah.
Right. So one of the things, can I share my screen to show you a visual? Okay. I think that will be helpful. May see if there's an ad that's popped up. No, thanks. Don't sign me up for ads. So this is what I shared with the group earlier, and that we based a lot of the sort of decision-making around, which is really nicely outlined from this visual here. So the deal with PCR tests and rapid tests are that they're both looking for virus in a specimen from the nose or the upper respiratory tract, but the amount of virus that's needed to be in that specimen is different. So a PCR test is very sensitive. It will pick up a positive case a little bit before a rapid test will turn positive, and it will pick up someone who was positive with COVID-19 for days, many days after that person is no longer infectious. That darker, kind of slightly darker, sort of pinky part in the middle is the infectious period, meaning this is when, if you are a COVID-19 case, you can spread it to other folks. The rapid tests turn positive in general. They're not perfect, right? But in general, they turn positive when somebody is infectious. So both are important results. We want to know how many cases there are and what is happening. But can you see my mouse when I'm sharing my screen here? Yeah, so if you are testing somebody in this range, right, like they're at day 10, maybe they just have come back from break, whatever the situation is, it's pretty rare too. Our nurses were telling us that there's been like 2 times or something where there's been a positive pool and the rapid test doesn't identify who the person is. So what might be happening in that is that you are testing folks here. The PCR test is still picking them up as a positive. They're no longer infectious. And the recommendation that Allison talked about with the update is not to not do a PCR anymore. But the protocol as it is right now, and Allison, correct me if I get something wrong, is that while the students in that pool wait for the results of the PCR test, which could be 2 or 3 or 4 days, they have to stay out of school.
Yes.
What we're suggesting is that it's sort of like test and stay for the people who are in a positive pool. So we can be looking for, if any of those people in the positive pool are actually in this time period, they'll turn up positive on the rapid test. It actually is giving us more information sooner than the PCR test, not disregarding the PCR test, but just while we wait for it, and allowing kids to stay in school rather than sending the whole pool home while we wait for that.
So why only 2 days though? Why not a few days till you actually get that answer?
I think, and Allison, maybe this is where you can sort of jump in. I think there are very specific rules from the state on how the Binax Now rapid tests can be used. And that's the average of how long we would be waiting for that reflex PCR test, that follow-up second swab PCR test.
Okay.
Right, the second
follow-up
swab
language.
is usually happening between 24 and 48 hours after the positive pool. So we think that the most we would need to do is 2 days, and then we would get the PCR test back.
Okay, that makes sense to me. Somehow, like you were talking about how they didn't have time to do the backup individual tests once their pool came back positive. You're saying that we would just buy them time until they actually did that backup test. Okay.
And if they don't, so the quarantine now from the state and the CDC is the isolation is 5 days from the date of the test. So in the situation like happened last week, we're actually doing so much more if we do this rapid test sort of each day while we wait for the PCR than other districts are doing while the kids stay in school. And the state might never run the PCR, not the state, Broad, might never run that individual PCR until that isolation period ends. They can actually run out the isolation period and be allowed back to school no matter what, because it's been 5 days since the test, right? So essentially using those rapid tests will help us to keep kids in school, but not letting infectious kids in school. Or again, this could be faculty or staff, but infectious people.
And
Okay.
this is very rare. This has only happened a few times.
Yes.
Okay.
So hopefully that helps. I think the like science of that is really important, that the rapid tests, they are missing. Absolutely, they miss cases. But the cases they're missing are not the ones that are going to light up a classroom
Right.
full of COVID.
Right.
Those kids are no longer infectious, particularly if they're vaccinated.
Right. Right.
There are vaccinated kids in a pool. We know the science telling us that the peak viral load might be about the same at one point in time, but the overall viral load is much lower. The infection clears much faster. It's a pretty safe all-around situation.
Okay. Yeah, that clarified it for me with them doing they're still running that backup test. You're just biding time using the rapid test. That makes a lot more sense.
And keeping the kids in school while you do it,
Right.
rather than
Oh,
having them
absolutely.
stay home.
Yep, I get it. Let's see, where did we go? So we did. Do we have any more questions about the athletics and spectators? Okay. Do we have any more questions about I'm satisfied with my pool testing question about the 2-day rapid tests, waiting for the results to come back. That makes me feel a lot more comfortable. Are there any more questions about test and stay ending possibly in March? Maren?
Yeah, I mean, if Megan, if you want to speak to why the recommendation from the COVID response team is moving in that direction, would be helpful.
Yeah, absolutely. So the way that test and stay works, I think this is a key part of it in terms of understanding Allison's suggestion here and recommendation. So the way test and stay works is that once you are identified as a close contact, your vaccination status is noted. Are you a person who is vaccinated or unvaccinated? It's not that you're not identified as a close contact. It's that what happens to you at that point is different. So for folks who are unvaccinated, I'll just keep calling them kids because it's easier to imagine. Kids who are unvaccinated, if they've been identified as a close contact, they get to go through test and stay. That way they don't get sent home for 5 days, of what used to be 10 days. If they are vaccinated, and this is something that I don't think that, and maybe this, Maren, was part of your point, I don't know that there is the ability to override the state's use of the Binex now tests on, they have some pretty strict regulations on how the rapid test can be used. The kids who are vaccinated, who are close contacts, do not have to quarantine. And that is true in the test and stay program as it is right now. So that's what happens like all year long. Some of the kids are in test and stay if they're unvaccinated. Some of the kids are just told they're a close contact and their families do with that what they will.
Wait, I'm sorry to interrupt, but and Dr. Leclerc, correct me if I'm wrong, but my understanding is that if you are vaccinated, if your status is vaccinated, you are not notified of being a close contact. Is that
No,
that
that's
incorrect?
not correct. That's not correct. You
Okay.
are notified, but
So-
we don't make any recommendation. As Megan said, you do with that information what you will.
If it's
Okay,
me,
so
I'm bringing them in for lots of tests because that's me. Some parents are like, it's okay. And we'll just wait the 5 days or whatever and find out.
okay, then I will just say I misunderstood from the very beginning of the school year then. So I just want to hear you say this again. So for all people who are considered are close contacts, they are notified, but is what the steps that are required of them is the only thing that is different based on their vaccination status.
That's
Vaccinated or
correct.
not vaccinated, they're still notified that they are a close contact.
Yes.
Okay, thank you for clarifying that.
Yeah, and that's been our practice all year long.
And so the recommendation to stop the test and stay program, as Allison was explaining, it's a huge burden on our nurses. And essentially, it's a burden on our nurses to conduct rapid tests daily for the group of students who are unvaccinated. It means they don't have time to do proper contact tracing. It means they don't have time to take care of checking kids, it's busy on a boring day, as Allison was saying. So it takes the resources of the people who are in the building doing the rapid tests of, I don't know what the breakdown is of the number of these 91 students who are in test and stay, but it's a huge number for them to be doing. So is that a fair use of our resources? Or should the students who, for whatever reason, are not going to be vaccinated, reasons not necessary to be described, they should just have the 5 days at home rather than having the test and stay program apply. Nothing changes for vaccinated students. They stay, they're notified as a close contact. The nurses have more time to do contact tracing. They can do it more rapidly. The difference is for the unvaccinated. Does that help?
Thank thank you. Yep.
Okay. All right.
I'll just say I think that's helpful, but I still don't think that it's necessarily something we should take away as a tool in our ability to support our community.
That's fair.
Well, what might also help, to your point and Ben's point, I think we've advertised for a nurse at least 4 times this year for additional nursing staffing. In any way, shape, or form we can get it, part-time, full-time, substitute, anything we can get. We can't find them. We have really tried to get additional people on board for this support. It is, it can't be volunteers because you do have to go into our student database system. There's confidential information in there because you need to know what classes students were in and what the seating plans are and who they're near and, how to contact those people. It's complex, but we have tried to get additional support, and it's really falling unfairly to some degree on our nurses and our building administrators because there are no other bodies. As Sean, noted before, we don't have spare people around, so it's really becoming a challenge for our staffing. So I would just put that out there to let you know that we have tried. Our administrators put it in the newsletter that they send out to families. We've put it on social media multiple times that we're looking for nurses or substitute teachers, anything, but we can all see the news and I don't think this is a Easthampton problem. I think this is a larger issue. So I just want to point that out.
The mayor wants to talk, but I have a quick question. When Hatfield had a large portion of people who needed to do test and stay, we had the National Guard come in. Is that still available to be extra hands?
I have not heard of that of late, but I can check. We also have asked Bree and the fire department if maybe we can possibly get some paramedics in the mornings to help us. I mean, we've tried to be creative. We worked with the city health department to think creatively about resources that we can use to help us in some ways, but we haven't solved it yet. But I will double check. I have not heard of the National Guard anywhere near us in the region lately.
Well, not lately, but when it was in December, and they were phenomenal. And it really took the burden off of everybody to be able to get those tests done. The mayor wanted to weigh in.
Hi. So a little of this has been covered, and I have to agree with the mayor. No, I'm the mayor. I always agree with myself. Those are the best conversations, actually. But anyways, with the protocols or what we're switching to, I don't really have an issue with it. It's a big change. Okay, and the science behind it meets my state comfort level. The questions though around testing, one, when you just said like the fire and health department, and so a paramedic would be able to contact trace because it would be okay for them to get into the software system to like trace everything down.
Yeah, I think we would hire them on for an hour or two a day and pay a fee and get them acclimated to the system.
And is there any contact tracing that can happen where somebody without that clearance, can just make the calls and write down name? I mean, I've never contact traced. So can they, sorry about that. Can someone, call and say, okay, I called about Cynthia and these are her close contacts, and then it's put into the system by somebody who has the clearance, or is that more work? Or
We've talked about LPNs, CNAs, someone like that. I think you have to have a basic understanding of the protocols, because many families are still confused and they have questions. They want, they need more information, or they have, little nuances that are related to their other children or things like that. So you need someone, I think, that has a medical background. And medical background people are pretty busy right now.
And even like, I don't think I'm allowed, I know I'm not allowed to see any of that information. So the data that I get is de-identified. So it requires a pretty high level of like going through clearance and stuff.
Yeah, and I imagined that, school, doing it for school would be different, but I wanted to ask that question. Then around masks and a higher level of mask, like the KN94s and whatnot, as well as rapid tests, maybe for families or however they could be useful. Can we use ESSER 3 money for that, Allison, and the state contracts?
Well, I'm glad you just reminded me, because I wrote that down to talk about it. So a couple of things. The testing, and I just want to clarify, I don't believe the union had any challenges with the testing materials that we brought in. They were Binax Now kits, so that's what all the teachers tested with last week. It is, we're working with the state, and we're working with an area health center that is going to be providing us with free rapid tests that we can disseminate to our student body, in particular our free and reduced lunch families, because I don't want not being able to purchase a test to be a hindrance. So that's one piece. And we're getting those for free. Those are being given to school districts for free. So the first pickup I have is this Saturday to get an allocation of those, and then we'll start disseminating them to our free and reduced families. That's where I'm starting, and then we'll see how many we get. And then we also saw something, I think it was in the Boston Globe, but I could be wrong, Mayor, that the governor said they were going to be pushing out more tests for school districts today.
Yeah.
Did you hear anything about that?
I did. Yep. Yes.
So I don't know what the time frame for that is, but I anticipate that to be relatively quickly. And so the testing, I think we may be in decent shape for. I mean, a lot of our staff and our students are already enrolled in pool testing, but I don't want to speak for the teachers union, but I think that testing everyone on the first day we returned, 100% of our teaching staff, gave everyone kind of, they felt better about returning to work. And so I want to do that after the February vacation, after the April vacation. I mean, I want to kind of set ourselves up so that we can continue to do that when we have kind of those pauses. The masks, Megan and I had a conversation about the masks today. I am not feeling comfortable in my expertise around masks. You know, for a superintendent, we received notification to come to a specified location and pick up masks. I didn't know anything about these masks. I went and picked them up. And, you know, some teachers do not feel that they are good enough. And that's, you know, there's data to support that they are not the best masks. So I don't have an opinion about it either way. But now there's a reluctance on my part as a superintendent. I don't claim to be an expert on KN94 and KN95 masks for adults or children. And, you know, it's so Megan has volunteered to look into that a little bit for me. And then the question becomes, you know, what is the pricing and how much can we sustain as a district, and for how long do we need to keep providing these. If it's for the remainder of the year, that could be quite an expense. I have talked with our health director to see if there's any MEMA funds we can access for this through the city. So that's an avenue that we're exploring. I know that other districts have received large donations. We have not in Easthampton. So to purchase the quantity that we would need, if the expectation is that people are replacing them daily or almost daily, then that's going to be a pretty large price tag. So could we use ESSER funds? We probably could, but all that money is already allocated for next year. So we would take away from something else in order to buy the masks now with those funds.
Speaking to that though, Dr. Leclerc, weren't we already purchasing PPE for staff? I thought that was something that we already did do and was planning on cycling as we needed to do.
Yeah, we have surgical masks, absolutely, which are better than cloth masks. And I think most studies would bear that out. So we have surgical masks as PPE that we have been purchasing all along. We have purchased some KN95s, particularly for some of our substantially separate programs for little ones that are unable to keep masks on appropriately, for the staff in those rooms and for the younger children, something that is farther away from their mouth because they can't, have something right on their mouth for the littlest little ones in our district. So we have had some success with that, but we have not bought KN95s or KN94s at a large scale. I think they're around $1 a piece. Is that what you said, Megan?
Yeah. So if you're an individual buying them, they're about $1 a piece, but I think we can get a bulk order for something closer to like the 80, 85 cents a piece. I haven't done enough research to be able to say that solidly. But just as Allison indicated, I'm strongly advocating for bulk supplying KF94s or KN95 masks for the district for staff and students. So stay tuned. I haven't stopped bugging Allison yet.
Yeah. No, I agree. I think if we can provide them, we should. If we can, we should.
Mm.
That's my hope.
Yeah, can I just jump in and maybe it saves Megan some time. So the city buys KN94s from Korea, and they've been averaging anywhere from 70 cents a mask to 79 cents. And Michael Owens, our procurement officer in the city, could give you that info. He is well researched with masks. So
I was going to say, does he have the research for those?
Oh my God!
I think it would. Yeah.
Oh,
I know Michael. Yeah.
Yeah. No.
All right. I'll go talk to him.
And Bree agreed with it. It wasn't just Michael, but yeah, he's been finding some great deals and has contacts because we've been ordering those for some time for the city employees. So don't know, and he might know, or maybe Allison's just better deal with the state. One thing that I've been pushing in my meetings is I don't understand why the schools can't submit for PPE to FEMA, because private schools can and Riverside can. I mean, the city does. That's an easy peasy one. But like, we're still buying PPE and getting right now 100% FEMA reimbursement. Now,
I did speak to Jen Gallant about that last week.
Great. Yeah. So I don't really get that. Why I think it would be great if DESE could provide all of the free PPE, on a consistent basis with, the same quality, but that doesn't seem to, they too are overwhelmed. It's not right. But I have wondered about that. We have found out that rapid tests aren't FEMA reimbursable at this point. We're fighting that, but you can use ARPA and ESSA money for the rapid test, like outside of the school program, if we wanted to. But yeah, I really don't, the FEMA stuff, or not being able for a school district to submit because they can't get proper number of masks, it makes no sense. Or face masks for those, the little ones or teachers that really need that extra is mind-boggling to me, and has been. And the mayor, we've been pushing pretty hard on that.
Mhm.
So that, I just wanted to kind of add that context. But yeah, Michael Owens, our procurement officer, can give you the scoop. And I don't know, we just ordered a whole bunch of them for a free mask giveaway to the public like we used to do, and more for the employees before we couldn't find them anymore. So it'd be interesting to know what that costs per mask. And just to add one last thing about rapid tests, we, for our community distribution for rapid tests, we have focused populations with the hope that we can expand. Like I would love to expand to small businesses, restaurants, and retail, because of a whole bunch of different reasons. We get better prices when we go out on our own than the state contracts by a lot. Sometimes we have to go up in price, but we're getting pretty good prices. I mean, we're getting sometimes anywhere from $1 to $5 less than what's on the state contract.
Wow.
Yeah. And again, it says for cities. I don't know why schools, a little soapboxy, but why recreate the wheel? Like, if we can get things certain ways, like get those, 200,000 masks, or instead of having somebody pick up masks on Saturday and they not know, give them to FEMA like they used to distribute. And then I don't get it. If there's anybody I can stamp my feet and sign into a letter to just make city and school more consistent for PPE, even if it's just for masks, I think would be it seems common sense. So
Agreed.
off the soapbox.
Lori,
had my 5 minutes.
Lori, before Megan.
I just wanted to state for the record, I want our district to be able to provide masks for teachers, and I don't want anyone to think what I was saying is that we shouldn't be. But I was just hearing a lot of complaints that people didn't feel safe with the masks that DESE provided and our district went to pick up. And I can tell you, somebody notified me that my supposed teaching district gave the good KN95, so I wanted to test it out. And I did yesterday. I picked it up, and I can't teach in a KN95. The KF94, to my personal standpoint, being able to speak and deliver for 5 classes in a row is so much easier. So I've tried both, and I'm all for the safety. But if we are going to purchase something, Dr. LeClaire, I suggest, as the mayor said, KF94s, not KN95s, unless people say otherwise. But it is so much more comfortable on the ears and being able to speak.
And they're really equivalent. I agree, KF. And from what I have seen, they are more easily available and tend to be a few cents cheaper in bulk. So KF94s are a win all around. So something that just occurred to me as we were talking about those masks that seem to be less efficient, perhaps if we come up with a strategy of supplying high quality masks, a mask that is a higher quality than even a surgical mask, but not as high as a KF94 might be a great choice for something like May and June, when our windows can be wide open and our case numbers have gone down, and this is my fingers are crossed and I'm knocking on things. So I know that Allison, you said earlier, like we're sitting on 9,000 masks. Like maybe we don't have to buy enough for the whole school year. Maybe we buy enough to get us through to when those masks are a good option again. And then the other thing I wanted to say, oh gosh, I can't remember what it was. Except that I think I was going to say that I've also been talking with Bree about ordering the masks and supplying masks and the KF94 or above. Oh, I know what it was. Is it possible if the city can get reimbursed at 100% that the city can be purchasing them for the schools since it's a public school?
So what we have been told in the past on other PPE for schools, because it doesn't make sense why we couldn't, is that FEMA, if it's for school purpose, that they have their own channels to go through, and the city is tracking it through public health and fire and police. It doesn't make sense to me, but we actually thought in the beginning, and then when CARES Act, they switched CARE Act money on some line items, including PPE, to 100% for non-fire, police, EMS, that we could just go to town on it. But we can't for the reimbursable. Jen is really, yeah, so.
So maybe I'm just being naive about this, but is it, does it make a distinction if so the kids are residents of Easthampton? So Allison says there's a KF94 or better mask mandate, and you can contact, if you are not able to purchase your own masks, you can contact the city and the city has a distribution. If it's not like through the school, is that, and I guess that would apply just to residents.
It would apply just to residents. Yeah. So like right now,
but maybe that's a middle ground to save some of the money.
So yeah, so we have, for instance, we have rapid tests right now. We got like 6,000, and they have gone out to seniors, folks who don't have constant contact with the medical or city government. If they live in a clustered neighborhood like Parsons Village, Treehouse. So we're going to those places and handing out rapid tests, and we'll continue to do that. We were hoping to get more. So everyone that we were distributing to got 4 per person, like, so 2 boxes for the people in the house, and we could not secure them fast enough with the pieces. Just the bureaucracy of it. So we're shopping again. Most all of the tests, we also did tests, 2 boxes of tests for every employee in City Hall. And yeah, we're going back out. We need clarification if we can bill FEMA for that. And rapid tests, are they PPE? Right now, FEMA's saying no, and we're using ARPA funds, which we run into the money too. I mean, it becomes a money issue for us. I think that from what I'm hearing, which is really whispery, the governor's budget, which should be out soon, there'll be separate provisions for free masks on a more, I'm hoping that the rapid tests and masks that we're buying to do public distribution, which, and actually, Megan, it's anybody. We don't ask for an address. Like if, my brother from Hoya comes over and gets in line, he gets a mask. I mean, we're not doing any checking. Just like with the PCR testing, we don't really care. What was I going to say? Yeah, any school, like a kid can come, a parent, a grandpa, whatever, and we have parents come through those mask giveaways, all the time and say, I need 2 for my grandkids or whatnot. We really don't get into it with anybody. But I am hoping after the budget is announced with the big surplus we have and the FEMA, and the ARPA money that the House and the Senate haven't spent yet, that there will be distribution of masks and rapid tests like there were back in April, May, June, where FEMA literally would just drop off 20,000 masks. So that works. And then just around the the National Guard, if we put in a request through the city and school, like Allison as a superintendent, obviously is a leader in our city, and request National Guard, a lot of other mayors and whatnot are saying, look, just ask. If enough of us ask, maybe, that's kind of how the hospitals, and we do have National Guard deployed. They were at Cooley. I don't think they're anymore. I think they're still at Bay State, and they're out in Worcester. So they're not been deployed to schools, but I think if there was a concrete ask around contact tracing or rapid testing or PCR, whatever, ask and kind of push it and encourage other school districts to ask, and select boards and mayors to say, can we have National Guard 2 days a week or whatever, Allison, you fit into the schedule. It would take a load off of the nurses. And, I haven't heard of National Guard doing anything but hospitals, and some local ones, but nothing with schools.
Were they driving bus for a while? I think the National
Say
Guard,
that again?
I think the National Guard was.
Yes, they were.
driving
Yes,
buses,
and
right.
they were driving buses at one point.
Right.
So I mean, I think that there's some creative asks there. I don't, you ask, and the worst that happens is they say no. But if we keep asking, maybe it'll push it over the edge.
It was helpful. It was helpful in Hatfield when they came, because we had so many days, and we had a lot of people that had to do test and stay. And there's no way we could have done it without them. So, I agree. The worst thing that'll happen is they'll say, no, they can't come.
Yeah, or they'll change their mind. And literally they'll change their mind. I know that the feeling underwater and being underwater, we certainly see it on City Hall, not, at the scale of the school district, but if even National Guard could drive buses for 10 days, it gives maybe a breath to other staff or come in and do the testing for 10 days or 3 weeks, nurses, everybody, like teachers, everybody can kind of take a breath and reorganize. And I mean, right now it's it's just like do. And, it's still we're still in the Wild West, so it doesn't move and we never know which way it's going to move. But I think that would be a great ask, even if we can get the National Guard for a little bit, to give people space.
Okay. Are we ready to move on to our superintendent update?
I think so.
Okay.
Okay. The only thing I wanted to say beyond that conversation was that we opened a new school last week, and it was pretty exciting. And so thank you to the school committee members that were there. We had a group of community representatives there, including fire and police, school committee members, some school building committee members that welcomed our students to the new school on Wednesday. And the students were really so excited to be in the new building. Finally, the building is beautiful inside. I don't want to speak for the teachers, but in walking around everywhere, teachers were very positive, and it is so different from Whitebrook. It's much brighter. It is there's a lot more natural light, and the classrooms are a great size. Teachers really were excited on Monday and Tuesday, working really hard to get their rooms ready for students on Wednesday. I observed them meeting the students in the lobby, escorting the students to their new classrooms. Then I was there for a while, and I saw teachers giving the students tours of the cafeteria and the gym, getting the students acclimated to the new school. So it was really quite exciting, and can't wait for the other half of the building to be finished to welcome our youngest students into the building. I will say as an aside that on Tuesday we did pool testing for teachers, and we decided to do it in that building just to give teachers in the other buildings a chance to walk, to go over there and kind of walk around. And the high school teachers were walking all around the building, loving it. So it was really a positive week in that aspect. So I would be remiss if I didn't share that under the announcements. So we're excited. We're really appreciative to the community and to the school building committee and to the school committee and the city council and the mayor for everyone's contribution to getting us to this place where we could actually open the door and welcome students in. So. Yeah. That's it.
Right. Thank you. Okay, so do we have, I don't see our student representative here tonight. Am I missing anything? No? Okay.
Actually, can I ask a quick question?
Yes.
I noticed that MASC is doing like an event for student representatives from the school committees. I think it's at the end of January. I have information that I could forward to her, but I wanted to at least let her know in case that was something she wanted to attend. It's like a half a day. They serve lunch. It seemed pretty cool, and if we could do it, that'd be great. But I just wanted to let
I did get that, Ben, so okay. I can forward that to her.
Great.
All right. Policy? Any update on policy?
We don't have an update right now. We haven't had anything come in from MASC. I just want to make sure that I will be getting those, Allison. Sue will send them to me since Shannon isn't available right now. I just want to make sure, because I wasn't on that list to get the initial policy changes.
I believe so. I can double check with Sue tomorrow and confirm.
Okay, thank you, because I just want to make sure, and then I will call a meeting if there's anything we need to update. And I know that Ben knows how to get on to the policy menu, which is now digitized, right? And anyone in the community can see it as well on our school website. So Sue did an amazing job getting all of that scanned in. So we need to thank her.
Okay.
Sue Colby. Thank you.
Thank you. Maren, do you want to do a finance update, please?
Yeah, so Finance Committee did meet yesterday. Thank you. I was nominated and elected back as the chair of the Finance Committee, so I'll continue in that role. And we did set dates to move forward with the budget process with the schools and leadership team to then be able to provide back a vote to this committee on the final budget, ideally the last week in March or the last meeting in March. But we're also still waiting for budget information from the mayor's office. And so hopefully that will still all work in timeline. But we do have dates starting February 7th to begin those those reviews of individual budgets.
Thank you. And Ben is going to be our collaborative representative. So I'm assuming the first meeting is the end of this month?
I haven't heard a word yet, but
Okay.
I'm prepared and I'm excited to see, what it's all about. I'll let you know.
Okay. Allison and Sue, I think that we need just to let the collaborative know. It's usually not me who lets the collaborative know who's doing it, but I certainly can. Is there an avenue right now for either Sue or Allison to let them know that Ben will be the representative so that he gets all of those messages? You're going to take care of that, Sue? Thank you. All right. So Megan, do we need to cover anything else with COVID advisory?
I'm just looking through my notes here. I think we covered Really all of it. I know Allison said that the testing situation is kind of nuts. That's not like a district thing, just clarifying that that's at the level of, and not even a state thing. The state doesn't run the tests. Institute called Broad Institute runs them. They also happen to run the PCR tests for Springfield College. And so I'm hearing this at every meeting I attend this week, which is just like they are absolutely swamped, and we should continue to expect these delays. So I'm glad that we have a plan for keeping kids in school and doing the rapid testing. And at one point during the meeting, I noted down that Allison said all that we did last week was deal with 91 COVID cases and open a new school. And I thought that seemed like more than enough for 1 week. So I noted that down. I think we talked about all of this. The two other things I wanted to say, and I think Allison said this as well, we're hoping perhaps we could do a vaccine clinic. There's some mobile units. I'm really excited about that possibility, particularly if we're talking about changing the test and stay protocols and phasing that out. It would be great if we can make that as easy as possible for families to be getting vaccinated. We looked up information on vaccine rates in the city right now. It's not a perfect representation of what's actually happening at the school, because not every 5 to 11-year-olds in the city in 01027 zip code is in the school, but it's a really good approximation. 51% of 5 to 11-year-olds are fully vaccinated. 79.2% of 12 to 15-year-olds are fully vaccinated. And, sorry, I'm going with the wrong numbers here. Oh, no, that's right. I'm going with the right numbers. And 79.0% of 16 to 19-year-olds in 01027 are fully vaccinated. So we're going to use that number, that proportion, and the number of students who are in our schools and the testing data. And we're going to do a little bit of interpretation to find out kind of like where the positive cases are happening. So that will be forthcoming, like if they're among vaccinated students or unvaccinated, or what might be going on there. I think that's all my updates.
Safety, Maren, there hasn't been a meeting. Okay. And wellness, there hasn't been a meeting, right, Lori?
But I'm working with Mass Department of Transportation, our Safe Routes to Schools. But before I mention that, I would just like to say again that I am so thankful to have our new members, and especially Dr. Megan Ward-Harvey, who is now on the COVID response team. Not only were we the only district that I knew of to have a COVID response team like that with school committee involved, but now I'm sure, someone can tell me if I'm wrong, that we are the only school committee with the COVID response team that actually has an epidemiologist as part of that team. So how fortunate we are. So thank you so much, Megan. And so talking about wellness, we can be well in all of this. And, I like to talk about our walk and ride to school. And I was approached again by, this time, our city planner, who put it in my ear, because I was kind of ignoring it, a winter February 2nd event. And he was like, it would be so good to help our case for getting funding from the state to be able to do our first winter event. So I suggested just doing it for the Mountain View School. And I said it's February 2nd, which is the state date. I'm not sure if it's the national date. But there are some opinions that said we should do the elementary schools as well. I was a little hesitant because I know our police help so much with this, but if it's like a snowy week, then the students would have to get around snowbanks and get down the main streets. So I'm really hesitant to say I want to include elementary school, but I'd love to hear from you, my colleagues on the school committee, especially, Maren, and you're always so involved with the bike. Do you agree that we should limit it to the new school and going on the bike path? I see the mayor going like that too. What do you think?
I mean, honestly, the distance from the public safety complex where we've generally met to get to the high school is a pretty short distance, and generally can be a pretty safe distance. I mean, I don't think that would be a reason to limit it. So if it's going to happen, I think we should encourage both of our schools to happen, but then maybe not to do our elementary schools. I don't know.
But the high school actually hasn't been involved for a while. They come and they help us because they're the helpers, the National Honors students, but we only had them actually participating the first time. But it was the elementary students that Jeff had said, well, they could do it too. And Scott Kavanaugh was all like, yeah, why don't we have the elementary do it too? And I'm just thinking of, little children going over the snowbanks and the police trying to monitor traffic if it is like a snowy week. Or so what I was asking is, should we keep it to just our new school? And that would be so enticing for when we have everyone going to the new school. Or do you want to include elementary schools? Or do you think we shouldn't do it? And I saw the mayor going like this before, so I'd love to hear your opinion because we do ask the police to get involved.
Yeah, I mean, I'm not worried about the police. I'm worried about temperature and a lot of planning to have to put it off. Also, the bitter cold, ice on the bike path. I mean, we're actually doing pretty well with the bike path and getting it plowed by I like to call them the snow yetis that go out. They're volunteers. It's a rough crew, but they get it done. And then Williston does a part of it too. But it can be icy. I think if everybody is aware, I'm not worried about the police. I think if there's a big plan, everybody is aware and open to it. Might be a last minute cancellation because of the weather, and snow is one thing. I'm thinking more like that leftover crusty ice when it's not snowy. And because of that, Lori, I agree. I feel bad for the elementary students because I know they love it. But yeah, I just think that's a tough lift. And it's a safety list. So if everybody knows it might be canceled at the last minute, or we take a look at the bike captain or something, and we know that going in, I think it's a great idea. I think it is so like Jeff Bag to say we should do this to get a grant rather than to say, oh, my two girls who are in the schools would love this, but he's a planner. He does well by us. That did make me smile.
So you think we should just do it though to Mountain View and only if conditions permit? So I can advertise it like that and get in touch with the administration. Dr. Leclerc, do you agree? Do you think your crew will be supportive? You're muted.
I think they will be, as long as the mayor said, as long as, the weather is conducive.
Yep.
And, just a reminder that it is still a construction zone.
Yeah. Okay. So we'll do that.
Ooh, I didn't even think about that. Yes.
Yeah.
Ooh, yes. That's a big one. Yes.
Okay. But we'll keep it limited to Mountain View. And I can check with the National Honor Society students if they would like to help out too, because they are always so wonderful. It's so fantastic to have those high school students involved. Thank you.
Okay. So now we're on to correspondence and gifts. That's you, Megan.
Okay, so first as a note, and I talked to Sue earlier this week that I'm still having difficulty with my EPSD email account.
Okay.
So we're hoping to get that straightened out, but through the help of my colleagues here, we have I've had the correspondences forwarded to me, and we have 3 to report. One from Dave Murrett, who wrote expressing his objection to the temporary restrictions to spectators at basketball games and practices, disagreeing with some of the information that was used to make the decision and asking for the policy to be reconsidered. There was an email from Sean Sheehan saying many of the things that he also said during Public Speak Today, which was great, requesting that bargaining begins to address staffing shortages, particularly related to salary and benefits and sick days. And then finally, we had correspondence from Pilar Goldstein D, who wrote regarding the current plans related to absences, noting that many students and staff are out sick or quarantining, and the situation seems a bit unmanageable for many, understanding that much of the guidelines are coming directly from the state and are not really open for us to change, but wondering if there's some opportunity for creative problem solving, addressing this high absenteeism, and what sort of that means for students and staff in this phase of the pandemic.
And were there any gifts?
I have one here. I would like to propose that we move to accept with gratitude and appreciation an anonymous monetary donation to Maple School.
Second.
And how much is the donation?
I don't know.
All right.
Cindy,
Okay.
should I know?
Do you know?
Should I know?
Usually we do. I did notice that was written in an unusual fashion, but
That's the way it was sent in to us
got it.
anonymously.
I
There you
stand
go.
by that I don't know.
Wait, not only was it anonymous, the amount was anonymous too?
Yes. Maybe it was $1 million. Who knows?
That's what I was thinking. I was like, woo. Yeah.
Okay, do we have a second?
Second.
Okay. Megan,
Megan Harvey, yes.
Mayor,
Oh, yes.
Maren,
Aaron Goldstein, yes.
Ben,
Ben Hersey, yes.
Lori,
Sorry, Garcia, yes.
and Cindy Kuzensky, yes. Okay, matters for action. We have minutes, and if everybody's had the chance to look at the minutes, there's not much to look at because we had very few meetings. Megan, do you want to make a proposal to accept that?
Yes, I'd like to move to approve the minutes of the January 3rd, 2022 special session meeting.
I second that.
And Megan,
Megan Harvey, yes.
Mayor,
Mayor LaChapelle, yes.
Baron,
Aaron Goldstein, yes.
Ben,
Ben Hersey, yes.
Lori,
Sorry, Garcia, yes.
and Cindy Kuzensky, yes. Payroll?
I have another one for us. I'd like to move to approve the minutes of the January 3rd, 2022
Oh.
executive session meeting as well.
I'll second that.
Megan,
Megan Harvey, yes.
Mayor,
Mayor LaChapelle, yes.
Aaron Goldstein, yes.
Ben,
Ben Hersey, yes.
Laurie Garcia, yes.
Cindy Kuzensky, yes.
We also have minutes to approve from December, and a matter of business. Indy, should the new school committee members abstain from voting on those, or should we move?
No, we just vote to approve those accounts.
Okay,
And
great.
Payroll.
Okay, so I would like to move to approve the minutes of the December. Oh, do you want me to go all the way ahead then? Is that what you're saying, to the accounts payable?
Yep. Do you
Okay.
have more? Do you have more on that than I
I
do?
do. I don't know. I do. I
I
have.
only have two.
Anyone else have the version I have with December 14th minutes?
Yes.
Yes.
Okay.
Okay. There you go.
Okay, I'll go through them then. I'd like to move to approve the minutes of the December 14th, 2021 regular meeting.
I second that.
Okay. Now that makes sense to why you had a question.
Yes.
And it does make sense to abstain from this vote.
Yes.
We can still pass this.
Yes. Okay. All right. So Megan,
Megan Harvey abstain.
Mayor,
Mayor LaChapelle, yes.
Aaron Goldstein, yes.
Ben,
Ben Hersey, abstain.
Lori,
Laurie Garcia, yes.
and Cindy Kuzensky, yes. Okay. All right.
I'd like to move to approve the minutes of the December 14th, 2021 executive session meeting with the stipulation to withhold until matters are resolved.
I second that.
Okay, Megan,
Megan Harvey, abstain.
Mayor,
Mayor LaChapelle, yes.
Maren
Maren.
Goldstein, yes.
Ben,
Ben Hersey, abstain.
Laurie Garcia, yes.
and Cindy Kuzensky, yes.
I'd like to move to approve the accounts payable authorization for payment dated 12/30/2021 in the amount of $297,226.58.
I second that.
Okay, Megan,
Megan Harvey, yes.
Mayor,
Mayor LaChapelle, yes.
Maren
Maren.
Goldstein, yes.
Ben,
Ben Hersey, yes.
Lori,
Laurie Garcia, yes.
Cindy Kuzensky, yes.
And finally, I'd like to move to approve the school payroll dated 12/30/2021 in the amount of $575,978.76.
I second that.
Okay, Megan,
Megan Harvey, yes.
Mayor,
Mayor LaChapelle, yes.
Maren,
Maren Goldstein, yes.
Ben,
Ben Hersey, yes.
Laurie
Laurie.
Garcia, yes.
and Cindy Kuzensky, yes. So that should be it, right? We're not missing any other ones.
That's it.
Okay, our next meeting dates, and Sue added them as kind of, we're really stretching all the way to June. So they are January 25th, February 8th, March 8th, and March 22nd, April 12th, and April 26th, May 10th, May 24th, and 6/14. So that's really nice to kind of plan your time out. Okay, is there any other?
Oh,
Oh,
I have other.
Okay, go ahead.
I just want, and I really don't mean to discuss it, but I do want to get it out there in the public because I'm already very concerned about DESE's direction, understanding that this is not a priority right now. We've got to figure out. But I am worried about absences, absenteeism of students and staff, the effect on time and learning. And also if a student or staff is out because someone else in the family is ill, and they're caretakers, or like we've had a couple of cases in City Hall where kids have been quarantined, so the parents can't come to work and vice versa. So I'm worried about the time and learning, a number of absences, and how, like, what the typical policy is and how we're going to deal with it this year. It just feels much more urgent just because we've had more in school. And I'm grateful for, the staff and what they're trying to balance, and for the kids for, the best that they can. They're dealing with it. But I am worried long term, and I'm hoping that DESE will give us and the families and the kids and the staff a wide berth of latitude and be creative. So just for future discussion, I wanted to get it out there.
Thank you.
Thank you.
Maren?
if I remember timing wise from previous conversation, Dr. LeClaire, was next meeting going to have a report back on the change of school times review? And given all of what we are dealing with, is that going to be postponed, or is that still going to be on the agenda for next meeting?
I think that I would prefer to postpone it until February. I have had a conversation with Julianne about a continuation of the youth risk behavior survey data, because that was in the December meeting and it was very quick. So she asked, because all of you had expressed interest in having more and having the Healthy Youth Coalition representative come back. We were talking about doing that on January 25th while it's still kind of fresh in your mind. So is that all right to have that on the 25th and then do the school time presentation on the 8th?
I'm certainly fine with that. I just wondered also just making sure that the data was being collected for the with students and stuff to be able to do that stuff. But if that waits till February, I'm fine with that personally.
Okay.
Great. Ben?
This is just building on what the mayor just said, but I was also kind of concerned about absence questions. And I heard from a few families who were describing getting letters. I don't know if it's from the district or if it's from the state. I don't know where the letter originates, but that the letter was quite threatening about truancy and that sort of thing. And I wondered if it's possible to kind of get some clarification about during COVID. I think I talked about this last meeting. Actually, I asked if all COVID related absences were excused, and you said that they were, which is great. But I think it'd be helpful for families to, if they're going to get a letter, the letter sounds pretty intense. And I think a lot of families that I heard from were upset about the tone of the letter. And this might be a policy question too, Laurie. And I wonder if we could kind of dig into maybe revising the letter, especially just now in this time when things are so complicated. It might be nice to be like, hey, families, not to scare you, but there's a lot going on and we would like you to know that we're here, but that kind of thing. Just a little more gentle in this day and age would be nice. I think we could do that.
Yeah. I'll take a look at the letter and get with my team and see if there's any way we can adjust some of the wording.
I'd be happy to help if that's beneficial.
Yeah, I don't think that's considered policy, though. I'm happy to talk about it. It's not. That's more procedure. So
Even better.
And then I guess just one last thing. I mean, we're already 2 hours in, so might as well keep going. I know we've got an executive session too. I'm joking. But so Ben and I sort of also both mentioned possibilities of seeking some sort of letter or some sort of push speaking out to DESE and governor's office around a number of different items. I don't know if that's something that Ben and I have seen a lot of nodded heads, so maybe Ben and I will circle outside of meetings and bring something to our next meeting to see if it's something that we can seek to approve and move forward. So maybe would it make sense probably to share that, whatever we're able to do, if we're able to get something done in the next 2 weeks, but in advance of the meeting, because obviously there's some difference of opinions on some different pieces of it. So, but maybe we can start floating some of those pieces around.
Yeah. So I was going to mention that and hope that if you and Ben are going to get together, what each individual committee member can do is just send you a couple of bullet points of what their major concern is. And that way you can, put it all together. We can't, necessarily you want to do it separately. So if each member just contacts the two of you with, can you put this in? Can you put that in? I think you can come up with a nice letter that we can all get behind. I think
so. Then the target of that letter will both be the governor as well as the Commissioner Riley.
Absolutely.
Speaking on our concerns, focused on testing, focus on masks, things like that.
Yep.
So.
Yep, absolutely. Thank you. Mayor?
Yeah, can I suggest that the letter also goes to the chair of the Board of Education and to Secretary Pizer?
Certainly.
Great.
Sounds good. Any
Ben,
other?
circle up.
Any other? Okay. So we are going to move into executive session. And so let's just roll call into executive session. And we will not be returning to regular session. We will be adjourning this meeting from executive session. So Megan? We're all just going to head in.
And how do we roll call out? Do I just say Megan?
I was just going to say, Megan's like,
Yep, I'm just waiting. Everybody say your name slowly. Megan.
Megan Harvey.
Lori.
Laurie Garcia.
Mayor.
Mayor LaChapelle.
Maren.
Maren Goldstein.
Ben Hersey.
And Cindy Kwasinski. So good night to everybody else. And we will go into executive session when Everybody, I'm going to stop recording.